All right, so we've got a pretty hefty stack of research here
Uh,
about Peyronie's disease treatments. It looks like you're trying to get a handle on the most effective and up-to-date info, maybe compare some options.
exactly.
We've got guidelines from both the American Urological Association and the European Association of Urology,
Hmm.
plus some in-depth studies and analyses. Should be pretty fascinating.
Absolutely. I think this will be a very informative deep dive.
Excellent. Now, I know you're already familiar with Peyronie's disease, but just a quick recap for anyone tuning in.
Sure.
It's a condition where scar tissue or plaque forms inside the penis, and that causes curvature, pain, and sometimes even trouble with getting or maintaining an erection.
Right, right.
Yeah, not exactly dinner table conversation, but definitely important stuff to discuss.
Absolutely. And it can have a really big impact on a man's life. So finding the right treatment is crucial.
Absolutely. Whenever I hear about a condition like this, I always think about all those ads I see for vitamins and supplements,
Oh, yeah.
promising like miracle cures.
Live, of course.
But do any of those actually hold up when you look at the research?
Well, um, not really. The AUA guidelines are pretty clear.
Okay.
Vitamin E and tamoxifen, not effective treatments for Peyronie's.
Wait a second. Tamoxifen. Isn't that for breast cancer?
Yeah,
What's that doing in this conversation?
that's a great question. Some researchers thought that maybe it could help because of its effects on certain hormones and tissue growth.
Oh, okay.
But studies have shown that it doesn't really work. It
Hmm.
doesn't improve the curvature, it doesn't really reduce that scar tissue, and in some cases, it might even make things worse.
Oh, wow.
Yeah,
So, yeah, a good reminder to always be wary of those quick fix promises, especially when it comes to something this sensitive.
absolutely.
It sounds like sticking with treatments that have solid evidence is definitely the way to go.
Yes.
So, where do the guidelines point us in that direction?
Well, the AUA guidelines strongly recommend collagenase injections for men with stable PD and significant curvature.
Okay. Collagenase. Now that rings a bell. Remind me again, what does collagenase do?
So collagenase is an enzyme that breaks down collagen.
Hmm.
Collagen is the main component of that scar tissue.
Okay.
And by injecting it directly into the plaque, it helps to soften and reduce the plaque, which can help straighten the penis.
Oh, right. Like directly targeting the root of the problem.
Exactly.
Makes sense. And this isn't like a brand new experimental treatment, is it?
No, no, not at all. It's been around for a while now and has been extensively studied.
Hmm.
In fact, it's the only FDA-approved non-surgical treatment for Peyronie's.
Oh, wow.
So, it's been thoroughly vetted.
Okay, so that's a pretty big plus for collagenase.
It is.
But we talked earlier about treatment needing to be individualized, right?
Right.
What about men who maybe aren't a good fit for collagenase or are interested in other options? What else is out there?
Yeah, there are definitely other options to consider. There are what we call intralesional treatments, meaning they're injected directly into the plaque. Interferon and verapamil are two examples.
Okay, so a similar delivery method, but different mechanisms of action, I guess.
Exactly.
So what are the pros and cons of each?
Well, let's start with interferon. It might help with pain and even improve blood flow to the penis.
Oh,
But there's a catch.
what's that?
It can sometimes cause flu-like symptoms, so you'd have to weigh whether the potential benefits are worth potentially feeling under the weather.
Yeah, that's a tough trade-off.
Right.
What about verapamil? How does it stack up?
So verapamil is a calcium channel blocker.
Okay.
And the idea is that it relaxes the smooth muscle in the penis, which could potentially reduce curvature.
Okay.
But the research on its effectiveness is a bit more mixed compared to collagenase.
So more uncertainty with verapamil.
Right.
Okay. I'm always curious about what's on the horizon.
Yeah.
Are there any up-and-coming treatments for Peyronie's? Maybe something less invasive than injections?
Well, there are a couple of exciting areas of research to keep an eye on. One is topical verapamil, so instead of injecting it, it's applied as a cream. And then there's penile traction therapy. So it involves wearing a device that gently stretches the penis over time.
Okay, so instead of like attacking the plaque directly, these therapies are more about like remodeling the tissue and stretching it out gradually, I guess?
Exactly.
But are these treatments like ready for prime time or is it more like wait and see?
Not quite ready yet. We need more research before we can confidently recommend them.
Makes sense.
There's always a balance between potential and proven effectiveness with any new treatment.
Right, proceed with caution.
Absolutely.
So it sounds like collagenase, interferon, and verapamil are the main non-surgical options right now.
Right.
Now, I noticed you mentioned something called electromotive drug administration, or EMDA, in your notes.
Yes.
That sounds pretty high-tech and honestly a little scary.
It does sound a little futuristic, doesn't it?
Yeah.
Basically, EMDA uses a mild electrical current to deliver drugs like verapamil and dexamethasone directly into the plaque.
Oh, okay, so less invasive than injections, I guess. But does it actually work?
That's where things get a little tricky.
Okay.
The research on EMDA for Peyronie's is a bit mixed.
So it's not a sure thing.
Not a slam dunk yet.
Yeah.
But there was one interesting study where it actually worked better than direct injections for pain relief.
Oh, really?
Yeah,
So maybe it's a good option for pain management?
potentially.
Oh, okay. I guess it's all about that ongoing research.
Absolutely. Research is constantly evolving, and our understanding of these treatments changes all the time.
Absolutely. So we've talked about a lot of non-surgical approaches, but sometimes surgery is necessary.
Right.
When would a doctor typically recommend surgery for Peyronie's?
Well, surgery is usually considered when other treatments haven't been successful, or if the curvature is so severe that it's causing significant problems.
Okay.
It's not the first line of defense, but it can be a very effective option for some men.
Makes sense. So what are the different types of surgery available?
There are two main approaches.
Yeah.
Polymication and grafting.
Okay, those terms sound familiar. Can you break those down for us again?
Sure. Plaquication is the simpler of the two. The surgeon basically shortens the longer side of the penis to straighten it out.
So it's like tightening a belt, but on the penis.
Exactly.
Okay, interesting. And what about grafting?
Grafting's a bit more involved. The surgeon removes the scar tissue and replaces it with a piece of tissue from elsewhere in the body. So it's like a patching job for the penis.
Wow, that sounds pretty intense.
Huh?
What kind of tissue is used for the graft?
That can vary depending on the situation.
Okay.
They can use a vein from the leg, skin from the foreskin, or even tissue from a donor.
Oh, wow.
Each option has its pros and cons, and the surgeon will choose what's best based on your individual case.
Okay, so grafting is definitely more complex and probably requires more recovery time, but it's incredible that surgeons can actually replace that scar tissue and, like, restore the penis to a more natural shape.
It is amazing what they can do these days.
It really is. So, a lot to consider. I imagine deciding on surgery is a pretty big decision.
Absolutely.
What kind of guidance do the AUA guidelines offer when it comes to picking a surgical approach?
Well, they strongly recommend using an inflatable penile prosthesis when surgery is needed.
Okay, an inflatable penile prosthesis. So not just straightening the penis, but also addressing any potential erectile dysfunction, right?
Exactly. Two birds, one stone.
Right.
And it makes sense because erectile dysfunction is a common complication, especially after surgery.
Oh, I see.
This approach addresses both issues at the same time,
Yeah, it makes a lot of sense.
potentially avoiding multiple procedures.
That's a really smart approach.
It is.
Are there different types of inflatable penile prostheses?
Yes, there are. And the guidelines actually highlight that prostheses containing reinforced silicone or bioflex material are often preferred.
Oh, really? Why is that?
Well, they tend to have fewer complications
Okay.
and higher satisfaction rates compared to other types.
So it's not just about getting a prosthesis, but also getting the right one?
Exactly. It's all about getting the best outcome and improving quality of life.
Right. And there's another important point that the guidelines make about surgery.
Oh, yes.
What's that?
They emphasize that surgeons should always try to model the penis during surgery to maximize curvature correction.
Modeling. What does that even mean in this context?
It basically involves manually bending and shaping the penis during the surgery to try and get the best straightening possible.
Oh, wow. So it's like a fine-tuning step
Exactly.
to get the best outcome.
It is. It's a delicate process, but it can make a big difference.
Yeah, I can imagine.
Yeah,
And I bet those inflatable prostheses lend themselves well to that modeling process.
you're right, they do. With inflatable prostheses, the surgeon has more flexibility to manipulate the penis during the procedure,
Oh, okay.
and that leads to better straightening.
It's amazing how much precision and skill goes into these techniques.
It really is. It's a testament to how advanced surgical techniques have become.
Absolutely. And it's reassuring to know that these treatments are constantly evolving.
Yes, they are.
Okay. So We've explored a lot of different treatment options today. And, you mentioned wanting to equip our listeners with the skills to decipher medical research on their own. And I think that's so important.
I think it's crucial, yeah.
It can feel really overwhelming to try and sift through all that medical jargon and statistics,
It can.
but it's really empowering to understand the evidence and make informed choices.
Absolutely.
So, for someone who's, say, reading a research article about Peyronie's, what are some key things to look for? What are the red flags? What are the green lights?
Okay, well, one key concept is evidence grades.
Okay.
Think of it like a grading system for research, just like the ABCs we all know from school.
Oh, okay. So like an A+ study is the gold standard.
Exactly.
And a C might be a little iffy.
Exactly. Grade A represents the most reliable evidence, usually coming from well-designed, randomized controlled trials. Grade B is moderate quality, and then grade C is on the lower end.
Got it. So I should be looking for those evidence grades when I'm reading a study. Okay. What else should I be paying attention to?
Well, the type of study is really crucial.
Okay.
Randomized controlled trials, or RCTs, are considered the gold standard in medical research.
Yeah, I've heard that term thrown around. What makes RCTs so special?
Well, they're designed to minimize bias and really get to the truth. They involve randomly assigning participants to different groups,
Okay.
including a placebo group, which helps control for a lot of different factors that could skew the results.
Right. So that makes the findings more reliable.
Exactly.
Okay. RCT's gold standard. Got it.
Yes.
Now, what about all the statistics you always see in those research articles? Any tips for decoding those?
Sure. Let's talk about the p-value.
Oh, the p-value.
I know it can seem like a mysterious beast.
Honestly, I usually just skip over that part.
Don't blame you. But think of it this way.
Okay.
The p-value tells you the probability that the study's results happened just by chance, like a lucky streak.
Oh.
So a lower p-value means the results are more likely to be real and not just a fluke.
So a low p-value, good sign.
Exactly.
Yeah.
And in medical research, a p-value of less than 0.05 is generally considered statistically significant.
Okay, so that means it's unlikely that the results happen just by chance.
Exactly. Like saying, hey, this is probably not a coincidence.
Right, right. Okay, so low p-value, good.
Yes.
Is there anything else about statistics that's important to understand?
Yes. Effect size.
Okay, effect size. Tell me more.
So effect size tells you how big the difference is between the groups being studied.
Okay.
Like those who are receiving the treatment versus those who are getting the placebo. It's not just about whether there's a statistically significant difference. It's about whether it's a difference that actually matters in real life.
Oh, okay. So a treatment could be statistically significant.
Right.
But if the effect size is small, it might not actually make much of a difference for the patient.
Precisely. And this is especially important in Peyronie's research because the placebo effect can be pretty strong.
Oh, interesting. So you're saying some men might actually see improvement just because they believe the treatment is working,
Exactly.
even if they're getting a placebo.
Right. And that's why having that placebo group in those studies is so important.
Yeah, it helps sort of filter out that placebo effect.
Exactly. Helps us figure out what the true effect of the treatment is.
Wow. There's a lot more to medical research than I thought.
There is.
It's like a whole other language.
It can feel that way.
But I guess the key takeaway is to be an active and critical reader.
Yeah.
Don't just take things at face value.
Absolutely.
Question everything, look for the details,
Right.
and of course, talk to your doctor.
Yes, always talk to your doctor.
Yeah.
They can help you figure out what the research actually means for you and your specific situation.
Absolutely. They can help you weigh the pros and cons and personalize everything.
Exactly.
Okay. Well, I think we're ready now to dive into some of the specifics of the treatments outlined in the AUA guidelines.
Okay, sounds good.
Where should we start?
Well, let's begin with the research on oral medications for Peyronie's.
Okay, oral medications. What are some of the ones that are commonly used?
Okay.
And what does the research tell us about how well they work?
Well, one medication that's been around for a while is potassium periminobenzoate, or POTABA for short.
POTABA.
Yes,
That's a mouthful.
it is. It's thought to work by boosting oxygen levels in the tissues and improving blood flow.
Okay, so not directly targeting the plaque, but trying to create a better environment for healing, I guess.
Right.
But does it work?
The research on POTABA is a bit mixed.
Oh, okay.
Some studies show modest improvements in curvature, while others don't find any benefit.
So not a slam dunk.
Not a slam dunk. Another one that's been studied is pentoxifylline.
Pentoxifylline. That's a new one for me.
It is. It helps improve blood flow by making red blood cells more flexible.
Okay.
It's often used to treat circulation problems in the legs, but Researchers have been looking into it for Peyronie's as well.
So the idea is that better blood flow to the penis might help. Does the research support that idea?
The research is limited, but one study did find that pentoxifylline was as effective as verapamil injections in improving curvature and plaque size.
Oh, really?
Yeah,
So it could be a good alternative to injections for some men.
potentially.
That's interesting.
But more research is needed to be sure.
Right. Always that caveat.
Yes,
What about vitamin E? Didn't we already kind of debunk that one?
we did. The AUA doesn't recommend vitamin E,
Right.
but there's one study I wanted to mention that looked at coenzyme Q10, or CoQ10.
CoQ10. I know it's an antioxidant,
Yes.
but what does that have to do with Peyronie's?
Well, it's thought to have similar effects as vitamin E, potentially reducing oxidative stress and inflammation.
So the theory is that less inflammation could mean slower progression of the disease,
Right.
or maybe even improvement in symptoms.
Exactly.
Okay. So what did this study find?
Well, it was a well-designed randomized controlled trial, which you'll remember is our gold standard.
Right.
And it compared CoQ10 to a placebo. And the results were actually pretty encouraging. The CoQ10 group showed a significant improvement in curvature compared to the placebo group.
Oh, wow.
Yeah.
That's pretty interesting. So while the AUA doesn't recommend vitamin E or CoQ10 right now, there is some evidence that CoQ10 could be helpful.
There is, but it's just one study.
All right.
We need more research
Of course.
to confirm these findings.
Okay, so more research needed on CoQ10. Are there any other oral medications worth talking about?
There are a few others like colchicine and tamoxifen, but the research on those is mixed as well, and they're not currently recommended by the AUA.
Okay. So for now, it sounds like pentoxifylline is showing the most promise as an oral medication,
It seems to be.
with CoQ10 as a potential option to discuss with your doctor.
Exactly.
Okay. What about topical medications? Are there any creams or gels that can help with Peyronie's?
There are a couple that researchers are looking at.
Okay. Less invasive, always appealing. What are they?
One is topical verapamil.
Wait, isn't verapamil an injection?
Yes, but they're also looking at it as a topical cream.
Oh, interesting. So you apply it directly to the skin instead of injecting it.
Exactly.
Does that work as well?
Well, one small study showed that it was effective in reducing curvature and plaque size.
Okay.
But again, we need more research to be sure.
Got it. Topical verapamil, a possibility, but more research needed.
Right.
Okay. Any other topical medications on the radar?
There's one more that's shown some initial promise.
Yeah.
Topical liposomal recombinant human superoxide dismutase.
Okay, we'll just call it LRHSOD for short.
Yeah, LRHSOD. Much easier.
What does it do?
It's an enzyme that acts as an antioxidant,
Okay.
protecting tissues from damage.
So the idea is it could reduce inflammation
Right.
and potentially even slow down scar tissue formation.
Exactly.
What does the research say?
So one small study found that it was effective in reducing pain associated with Peyronie's,
Okay.
but it didn't really have much of an impact on curvature.
So potentially good for pain management, but
Yeah.
not so much for straightening.
Right. And as with many of these treatments, more research is needed to confirm those initial findings.
Of course. So it sounds like topical medications are still sort of an evolving area of research.
They are.
Okay. Are there any other non-surgical options that we haven't talked about yet?
Yes, there's one more that's gaining some traction, pun intended.
Okay.
It's called penile traction therapy.
Penile traction therapy. I'm intrigued.
It involves wearing a device that gently stretches the penis over time.
So instead of breaking down the plaque, it's more about stretching the penis back into shape.
Exactly. It's
What?
like a workout for your, well, you know.
Right.
Yeah.
Does it actually work?
The research is actually quite promising.
Oh, really?
Yes. Several studies have shown that it can help reduce curvature and improve penile length.
Wow, that's great news.
It is.
Are there any downsides or challenges?
Well, the main downside is that it requires consistent use for several hours each day.
Yeah, that could be tough for some people.
Yeah, it can be inconvenient for some men.
But if it helps you avoid surgery or injections, it might be worth it.
Exactly.
Okay. Anything else to keep in mind about penile traction therapy?
Yes, it seems to be most effective in the early stages of the disease when the plaque is still forming.
So early intervention again?
Yeah, exactly.
Okay.
And it's important to use a device that's comfortable and fits properly to avoid any discomfort or complications. Your doctor can help you choose the right one.
Okay, so talk to your doctor about it.
Absolutely.
Make sure you're getting the right device and the right guidance.
Right.
It sounds like this penile traction therapy has a lot of potential.
It does, especially for those in the early stages.
Yeah.
And one more thing, it can also be used in combination with other treatments, like injections or even surgery.
Oh, so it's not necessarily in either situation.
Exactly. Sometimes combining approaches can give you the best results.
Yeah, it's all about finding that right combination, that personalized approach.
Exactly.
Okay, I have to admit, I'm feeling a little overwhelmed by all these options.
I understand. It is a lot to take in.
Yeah.
But the good news is that there are effective treatments out there, and the research is moving forward.
That's good to hear.
Yeah, it's an exciting time.
It is.
Yeah.
So, for someone trying to make sense of all this, what's the best way to approach it? What's the first step?
I would say the most important step is to find a doctor who specializes in men's sexual health.
Yeah.
And has experience treating Peyronie's.
Okay, find the right doctor. Makes sense.
Yeah, you want someone who's up to date on the latest research
Right.
and treatment options.
Okay, so finding the right doctor is step one.
Yes.
What else can someone do to be proactive about their health when it comes to Peyronie's?
I think it's really important to be mindful of the potential psychological impact of Peyronie's disease.
Psychological impact? How so?
Well, those physical changes associated with Peyronie's
Mm-hmm.
can often lead to anxiety, depression, even low self-esteem.
Yeah.
Men might worry about their body image, their sexual performance, and how their partner perceives them.
It makes sense. It's a sensitive issue, definitely tied to a lot of insecurities, I imagine.
Absolutely.
Mm.
And these feelings can be made worse by the fact that Peyronie's is often misunderstood, even by healthcare providers.
Oh, wow.
Yeah,
So you might feel isolated
right.
and alone in your struggle?
Unfortunately, that can happen. But it's so important to remember that you're not alone.
Right.
Many men have successfully managed their Peyronie's
Mm.
and gone on to live full and satisfying lives.
That's good to hear.
Yeah, and there are resources out there to help you cope with the emotional and social challenges of this disease.
So what kind of support is available for men who are dealing with this emotional side of things?
Therapy or counseling can be really helpful. Talking to a mental health professional can give you a safe space to process your emotions,
Okay.
develop coping strategies, and improve communication with your partner.
Right. Sometimes just having someone to talk to who gets it can
Exactly.
make all the difference.
Absolutely. And there are also support groups where men can connect with others facing similar challenges.
Oh, okay.
Share their experiences,
Yeah.
get advice. That can be incredibly validating.
Yeah, a sense of community.
Exactly.
Yeah. So professional help and support groups. What else can men do to manage the emotional impact of Peyronie's?
Focusing on self-care is really important.
Okay.
Make time for the things you enjoy, practice relaxation techniques, and maintain a healthy lifestyle.
Right. It's easy to get so caught up in the medical side of things
It
and
is.
forget to prioritize our mental and emotional well-being.
Yeah, it's all connected. By addressing both the physical and psychological aspects, you can really improve your overall well-being.
Okay, I like that. So from all the information we've talked about today, what stands out to you? What questions would you be asking your doctor at this point?
Well, it really strikes me how much we still don't know about Peyronie's, even with all the advances in treatment.
Yeah, it's still kind of a mystery.
It is. There's no guaranteed cure, and we don't fully understand what causes it.
That's true.
And that really emphasizes the importance of continued research
Yeah.
to try and understand those root causes and develop even better, more targeted treatments.
I'm definitely curious to see what the future holds for Peyronie's treatments.
Me too. It's a very active area of research.
Okay. Well, let's move on now to another really interesting aspect of this.
Okay.
A treatment that doesn't involve medications or devices at all.
Intrigued. We'll delve into that in the next part of our deep dive.
Sounds good.
So let's talk about a treatment that doesn't involve any medications or devices.
No, okay.
It's called extracorporeal shockwave therapy,
Okay.
or ESWT for short.
ESWT. Now that sounds familiar. Isn't that used for breaking up kidney stones?
You got it.
I had no idea it was being used for Peyronie's disease.
It's been investigated for a lot of different conditions, actually.
Hmm.
And there's some interesting research on its potential for PA, particularly for pain management.
Oh, okay. So instead of pulverizing kidney stones, how does it work for Peyronie's? Is it like a tiny jackhammer for scar tissue?
Not quite. It's a lot gentler than that.
Okay.
For PD, it involves applying low-intensity sound waves to the affected area,
Mm.
kind of like a gentle sonic massage.
Okay, so no internal demolition.
Nope.
So how do those sound waves help with Peyronie's?
The idea is that they stimulate blood flow
Okay.
and promote tissue healing. That could potentially reduce pain and inflammation.
So it's not targeting the plaque directly. It's more about encouraging the body to heal itself.
Exactly, giving it a little nudge in the right direction.
Okay, that makes sense. But does it actually work?
Well, the evidence is a bit mixed, like with a lot of things in medicine. Some studies have shown that it can help reduce pain,
Okay.
but its effect on curvature is less clear.
So it might be good for pain management, but not necessarily for straightening.
Yeah, that's a good way to put it.
And I guess like any treatment, it has potential side effects, right?
Yeah. Yes, it's important to be aware of those. You could have some bruising and swelling.
Okay.
So, as always, you need to weigh the potential risks and benefits with your doctor.
Right. Informed decision-making.
Absolutely.
So did the AUA guidelines say anything about ESWT for Peyronie's?
They do. They give it a conditional recommendation.
Conditional recommendation. What does that mean exactly?
Well, it means it might be an option for some men,
Okay.
but the evidence isn't strong enough for a definitive yes or no.
So it falls into that maybe category?
Exactly.
Yeah.
It really comes down to a discussion between the patient and their doctor.
Okay, personalized medicine strikes again.
Absolutely. Patients really need to understand both the potential risks and the benefits before making a decision about their treatment.
Okay. So we've debunked those supplement myths.
Right.
We've looked at a whole bunch of treatments, surgical and non-surgical. A lot to process.
Is.
What are some key takeaways for our listeners who are trying to make sense of all this?
Well, I think one of the most important things to remember is that there's no one-size-fits-all solution for Peyronie's.
Right. Makes sense.
Treatment has to be tailored to the individual, taking into account things like how severe their condition is, what their specific symptoms are, their overall health, and what their goals are.
So what works for one person might not work for another.
Exactly. It's a collaborative process
Okay.
between the patient and their doctor
Right.
to figure out the best approach.
And it sounds like early intervention is key.
Absolutely.
Yeah.
The sooner you address it, the better your chances of slowing down the progression
Okay.
and preventing complications.
So don't wait and see.
Exactly. Talk to your doctor
Right.
as soon as you notice any symptoms.
Okay. That's good advice. Anything else?
Yes. It's important to be patient
Okay.
and realistic about the treatment process.
What do you mean by that?
Well, some treatments take time to show results,
Uh-huh.
and there's no guarantee of a complete cure. It's a journey, and it might involve trying different approaches until you find what works best for you.
So manage expectations.
Exactly.
And stay positive.
Absolutely. And remember, there are resources out there
Right.
to help you along the way. Your doctor, therapists, support groups. Don't be afraid to reach out.
Right. You don't have to go through this alone.
Exactly.
Okay. Well, it's really interesting to see all the research that's been done on Peyronie's.
Yes.
And it sounds like there are some promising areas for future research,
Yes.
new treatments on the horizon.
Yeah, definitely.
What are some of the things that researchers are excited about right now?
One area that's generating a lot of excitement is the use of stem cells.
Stem cells. I've been hearing a lot about those.
Yeah, it's a hot topic.
How are they being used for Peyronie's?
Well, they're looking into using stem cells to regenerate damaged tissue in the penis.
Oh, wow. So instead of just breaking down the scar tissue,
Right.
they're trying to replace it with healthy tissue.
Exactly. So a very innovative approach.
That's pretty amazing.
It is.
Are there any clinical trials going on right now using stem cells for this?
Yes, there are several early stage trials
Okay.
exploring the safety and effectiveness.
Okay.
It's still early days, but the initial results are encouraging.
So it's something to keep an eye on.
It is, definitely.
Are there any other areas of research that have you excited?
Yes, gene therapy is another one.
Gene therapy. Now that sounds like something straight out of science fiction.
It does, doesn't it? But it's a real thing.
How would that even work for Peyronie's?
Well, researchers are looking at ways to modify the genes
Okay.
that are involved in scar tissue development.
Oh, wow.
So potentially prevent or even reverse the formation of plaque.
So instead of treating the symptoms, they're going right for the root cause.
Exactly. Gene therapy is a really revolutionary field,
Yeah, it sounds like it.
and it could change how we treat many diseases, including Peyronie's.
It's really incredible to think about the possibilities.
It is. It's really exciting.
Yeah. It sounds like the future of Peyronie's treatment is pretty bright.
I think so, too. With research and innovation ongoing,
Yeah.
I think we'll see even more effective and less invasive treatments in the years to come.
That's great news for men who are dealing with this condition.
It is.
Encouraging to know that there are so many people working on this.
Absolutely. It's a testament to scientific progress.
Okay, so we've covered a lot today.
Yeah.
From those supplement myths to all sorts of different treatment options, the well-established ones and the experimental ones.
Right.
What are some final thoughts you want to leave our listeners with?
I think the most important message is this. If you're concerned about Peyronie's disease, don't stay silent. Don't suffer in silence.
Right.
Talk to your doctor, do your research,
Mm-hmm.
and be proactive about your health. Remember, there's help out there. You don't have to go through this alone.
That's a really important message. And, you mentioned earlier about wanting to highlight the research behind these treatments.
Yes,
I think it's so important for people to be able to understand that research.
I agree. It empowers people to make informed choices about their health.
So for someone who's reading those research articles, what are some red flags, some green flags? How can you tell if the research is good?
Well, one of the first things to look at is the quality of the study itself.
Okay.
Not all studies are created equal.
Right.
Some are much more rigorous and reliable than others.
So how can you tell if a study is high quality?
Well, look for randomized controlled trials,
Mm-hmm.
or RCTs.
Okay, RCTs.
Yes, they're the gold standard.
We talked about them earlier. Remind me again why they're so good.
They're designed to minimize bias
Okay.
and to make sure the results are accurate.
Mm-hmm.
They do this by randomly assigning participants
Okay.
to different groups,
Yeah.
including a placebo group.
Right. So it helps control for those other factors that could mess up the results.
Exactly.
So look for RCTs. Got it.
Yes. Another important factor is the sample size.
Okay, sample size, so bigger is better.
Generally, yes. A larger sample size
Okay.
means you can be more confident that the results are accurate. For the whole population,
Right.
small studies can sometimes be misleading.
So it's like you need a big enough sample to see the whole picture.
Exactly.
Got it. What about the statistics?
Ah, yes. The statistics.
Any advice on understanding those?
Let's talk about that p-value again.
Okay, the p-value. I'll be honest, I tend to just skim over that part.
I don't blame you.
Yeah.
It can be a bit confusing. But remember, it tells you the probability
Okay.
that the results happened just by chance,
Okay.
like a lucky streak.
Right. So lower p-value means it's more likely to be real.
Exactly. A p-value of less than 0.05 is generally considered statistically significant.
So that means it's probably not just a coincidence.
Exactly.
Okay. Low p-value. Good.
Yes. And it's also important to consider effect size.
Okay, effect size. Remind me what that is again.
Effect size tells you how big the difference is between the groups.
Okay.
It's not just about whether there's a statistically significant difference.
Mm-hmm.
It's about whether that difference actually matters in the real world.
So a treatment might be statistically significant,
Right.
but if the effect size is tiny,
Yes.
it might not make a difference you would actually notice.
Exactly.
Okay, that makes sense. And this is especially relevant with Peyronie's, right? Because of the placebo effect.
Exactly. Remember, the placebo effect can be quite strong.
Yeah, so some men might actually improve just because they think the treatment is working.
Right. That's why it's so important to have a placebo group
Mm-hmm.
to separate the true effect
Right.
from the placebo effect.
Okay. Wow, so much to think about when you're reading these studies.
There is. It's like detective work.
Yeah. But the main takeaway is to be critical.
Yes.
Think about what you're reading.
Question everything.
Exactly.
Look for the details.
And of course, talk to your doctor.
Always.
Okay. So we've got those basics down.
Yes.
Let's talk about some specifics now.
Right.
What have we learned about the different treatments?
Let's start with collagenase injections.
Okay. Collagenase, the FDA-approved one.
Yes. The most comprehensive research on collagenase comes from two large clinical trials, the IMPRESS-I and IMPRESS-II trials.
Okay. IMPRESS-I and II, I've seen those mentioned. What did those trials show?
Well, these were double-blind, placebo-controlled trials.
Okay. The gold standard.
Exactly.
That's good.
So neither the participants nor the researchers knew who was getting the collagenase and who was getting the placebo.
Okay. That's important.
Yes, to eliminate bias. And the participants received a series of injections into the plaque over several months,
Mm-hmm.
along with those modeling techniques.
Right. The bending and shape.
Exactly.
Okay.
And the results were really impressive.
Really?
Both trials showed that collagenase injections significantly reduced curvature.
Compared to the placebo, of course.
Right?
Okay. So that's pretty strong evidence.
It is.
But how much improvement did they see? What was the effect size?
On average, men who received collagenase saw a reduction in curvature of about 17 degrees, while those who received the placebo only experienced a reduction of about 10 degrees.
So a difference of about 7 degrees. Is that enough to make a real difference?
It is. A 7-degree reduction can significantly improve a man's ability to have intercourse
Oh, wow.
and improve his quality of life.
Okay, that's great.
So it's not just a statistical difference, it's a real-world improvement.
That's what matters.
Yeah.
Okay, but were there any side effects?
Well, the most common side effects were bruising, swelling, and pain at the injection site.
Okay, that makes sense.
Things you'd expect with injections.
Yeah.
And the good news is they were usually mild and temporary.
Okay. Nothing too serious.
There were a few rare but serious side effects reported, though.
Oh, like what?
Things like penile fracture and corporal rupture.
Those sound scary.
They are serious.
Yeah.
But it's important to emphasize that they were very rare.
Okay, so risks to be aware of, but not common.
Right. So overall, collagenase appears to be a safe and effective treatment.
Okay.
But it's essential to discuss those potential risks and benefits with your doctor.
Absolutely. Informed decision-making again.
Yes.
Okay, what about interferon?
All right, interferon.
We talked about how it might help with pain and blood flow.
Right.
Well, what does the research actually say about how well it works?
Well, one of the key studies on interferon was a randomized controlled trial that compared interferon injections to placebo injections.
Okay, similar to the collagenase trials.
A very similar design.
What did they find?
They found that interferon was more effective than the placebo
Oh,
in reducing both curvature and plaque size.
so it seems like it's actually working on the plaque itself.
Yes, it does seem that way. And another interesting point,
What's that?
the men in this study all had stable Peyronie's disease,
Okay.
meaning their curvature had stopped progressing.
So for men with stable PD,
Right.
interferon could be a good option.
Yes.
Okay. What about the effect size? How much improvement did they actually see?
On average, men who received interferon saw their curvature decrease by about 13.5 degrees,
Okay.
while those who got the placebo only saw a reduction of about 4.5 degrees.
A difference of 9 degrees? That's pretty significant.
It is, and the study also found that it was effective in reducing plaque size and improving pain.
Wow, so it hits all the major points.
Yeah, seems to.
Now, we did talk about the potential for those flu-like symptoms.
Right.
Did the study show that those were a common problem?
Yeah, unfortunately they were. A significant percentage of the men who received interferon did experience flu-like symptoms.
Okay. Fever, chills, muscle aches, that kind of thing.
Exactly.
Not fun.
No, not fun at all. But the good news is they were usually mild,
Oh,
and they didn't last very long, just a few days in most cases.
okay, that's good.
And often, over-the-counter pain relievers helped.
So not a walk in the park, but manageable.
Right. And some men also experienced swelling and bruising at the injection site,
Okay.
which is pretty common with these injection therapies.
Right, we've talked about that.
Yeah. So overall, interferon can be an effective treatment,
Mm-hmm.
but those flu-like symptoms might be a deal breaker for some.
Yeah, I can see that.
Okay. Now let's move on to the research on verapamil injections.
Okay, verapamil.
Yes.
That's the calcium channel blocker, right? The one that's thought to relax the smooth muscle.
That's the one.
What does the research tell us about how well that works for Peyronie's?
Well, the research on verapamil is a little less clear-cut.
Okay, how so?
There have been quite a few studies,
Okay.
but the results have been inconsistent.
Really?
Some show improvements
Hmm?
in curvature, plaque size, and even pain,
Okay.
while others haven't found any significant benefit.
Huh. So, not as consistent as the other treatments we talked about?
No, not as much.
What do you think might be contributing to those inconsistent results?
Well, one possibility is that the dosage and frequency of the injections has varied a lot across different studies.
Oh,
Another factor is that the studies have included men with different stages of the disease.
right. So it's hard to compare the results when those key things are different.
It is. It's like comparing apples and oranges.
Yeah, good analogy.
So it's hard to draw firm conclusions about its overall effectiveness.
Okay, so more research is needed, I imagine.
Definitely. Especially those high-quality randomized controlled trials
Right.
with consistent dosages
Okay.
in patient populations.
So verapamil is still kind of a question mark then?
Yes.
What about the AUA guidelines? Do they recommend verapamil?
They give it a conditional recommendation.
Conditional again.
Yes.
Okay, so that means the evidence isn't super strong.
Exactly. There might be better options out there.
Right, so it's not a first-line treatment,
Right.
but it's still an option in some cases.
Yes.
What about side effects? Anything to be concerned about with verapamil injections?
Well, the most common side effects were pain and bruising at the injection site.
Okay, sounds familiar.
Yeah, very typical,
Right.
usually mild and temporary.
Were there any reports of more serious side effects?
There were a few rare cases of priapism.
Priapism. What's that?
It's basically a prolonged erection that can last for several hours.
Oh, wow. That doesn't sound good.
it can be very painful.
Yeah, I can imagine.
And if it's not treated quickly, it can damage the erectile tissue
Oh, wow.
and potentially lead to ED.
So it's definitely something to be aware of.
Yes, but again, it's very rare.
Okay, good to know. So we've covered collagenase, interferon, verapamil.
Yes.
What about that electromotive drug administration, the EMDA?
Yes, EMDA.
One that uses electrical currents to deliver the drugs.
Yeah, it's an interesting approach.
It is, but how well does it work?
Well, the research on EMDA for Peyronie's is still quite limited,
Okay.
and the results have been kind of all over the place.
Inconsistent, like verapamil.
A bit, yes. Some studies show some improvement,
Okay.
while others show no benefit at all.
Why are the results so mixed, do you think?
Well, it could be that the studies are using different types and dosages of drugs
Oh,
and different EMDA protocols.
right. So it's hard to compare.
Exactly. It's hard to know what's really going on.
Yeah. So more research needed, I imagine.
Yes, definitely. We need more well-designed, randomized controlled trials
Okay.
with standardized protocols.
Okay. So EMDA is still an open question.
Yes.
What do the AUA guidelines say about it?
They actually specifically recommend against using EMDA with verapamil.
Oh, really? Why is that?
They say there's not enough evidence to support it.
Okay. What about EMDA with other drugs?
The guidelines don't address that specifically,
Okay.
but they do stress that any treatment should have solid evidence to support it.
Right. So proceed with caution.
Absolutely.
Yeah.
And have a good conversation with your doctor about the potential risks and benefits.
Okay, good advice. Were there any side effects associated with EMDA?
The most common ones were pretty mild, things like skin irritation and redness
Okay.
at the treatment site.
So nothing too concerning?
No. There haven't been any reports of serious side effects related to the EMDA procedure itself.
Okay.
But remember, the drugs delivered via EMDA can have their own side effects.
Right, right. The verapamil, the dexamethasone, we talked about those.
Exactly.
Okay, so it's important to think about those potential side effects as well.
Absolutely.
Okay. So we've covered a lot of ground on the non-surgical treatments.
We have.
Let's talk about surgery now.
Okay.
This is obviously a sensitive topic,
It is.
but it's important to understand all the options.
Absolutely. Surgery is usually reserved for severe cases
Okay.
that haven't responded to other treatments.
So it's not a first-line treatment.
No, definitely not. It's a big decision,
Yeah.
but it can be life-changing for some men.
Okay. What are the main surgical approaches for Peyronie's disease?
The two most common procedures are application and grafting.
Okay, application and grafting. We talked about those earlier.
We did.
The twig analogy and the patching job.
Exactly.
Remind us again how those work.
So application is the simpler one.
Okay.
The surgeon basically shortens the longer side of the penis
Right.
to straighten it out.
Okay. What about grafting?
Grafting's a bit more complex.
Right.
The surgeon removes the scar tissue
Okay.
and replaces it with a piece of healthy tissue
Mm-hmm.
from somewhere else in the body.
And what kind of tissue is used?
That can vary
Yeah.
depending on the situation.
Okay.
They can use a vein from the leg, skin from the foreskin, or even donor tissue.
Wow. So different options depending on the case.
Exactly. The choice depends on a lot of things.
Okay.
The size and location of the plaque, the patient's overall health, the surgeon's experience.
Okay, so lots of factors.
Yes.
So how do doctors decide between vitilication and grafting?
One of the key factors is the severity of the curvature.
Okay.
Placation is usually preferred for milder cases,
Mm.
while grafting is often recommended for more severe curvature.
So how much bending there is
Right.
helps determine the approach.
Exactly. Another consideration is the patient's erectile function.
Okay.
Placation can sometimes worsen erectile dysfunction.
Oh, wow.
So it might not be the best choice for men who are already having issues in that area.
So grafting might be better in that situation?
Yes, even if their curvature isn't as severe.
Oh.
And in some cases, the surgeon might recommend a penile prosthesis.
Oh, right. To address both the curvature and the ED?
Exactly.
Okay.
They can offer the best outcome.
Makes sense.
It's all about optimizing the results and improving the quality of life.
Okay. So what do the AUA guidelines say about all of this? What are their recommendations?
Well, they emphasize that the surgeon should carefully evaluate each patient
Okay.
to determine the best approach.
So personalized medicine, I guess.
Absolutely.
Okay. What else?
They also stress that surgeons should use techniques that preserve penile length as much as possible.
Oh, okay. That makes sense.
And along those lines,
Yeah.
they specifically recommend against an older technique called Nesbit plication.
Okay, Nesbit plication. Why is that one discouraged?
It involves removing wedges of tissue
Okay.
from the tunica albuginea,
Okay.
which is that fibrous sheath around the erectile tissue.
Okay.
The problem is this technique can shorten the penis,
Oh, wow.
which is why it's not really recommended anymore.
So Nesbit plication is out? Okay, good to know.
They also recommend considering an inflatable penile prosthesis for men who are having surgery and also have erectile dysfunction.
Okay, that makes sense.
Yeah, addressing both issues at once.
Right, right. And they recommend those specific types of prostheses.
They do. The ones reinforced with silicone or made of Bioflex,
Okay.
because those tend to have fewer complications.
So it's not just about getting any prosthesis, it's about getting the right one.
Exactly. It's important to choose wisely.
Okay. Any other important points about surgery that we should mention?
I think it's crucial to remember that any surgery has risks.
Of course.
So it's really important to talk to your doctor
Mm-hmm.
about those risks and benefits.
Right. Surgery is a big decision.
It
It's
is.
not something to take lightly,
No.
but it can be a really good option for some men.
Yes. For those who haven't found relief with other treatments,
Yeah.
it can be a really positive thing.
Okay. Well, we've covered a lot of different options.
We have, from oral medications to surgery.
Yeah. It's a lot to think about.
It is. But the good news is there are effective treatments out there.
That's good to hear.
Yeah. And research is ongoing,
Mm-hmm.
always learning new things.
That's exciting.
It is. And remember, treatment has to be individualized.
Right. Personalized medicine.
Yes. What works for one man might not work for another.
Okay. Any other key takeaways for our listeners?
Yes. Don't underestimate the power of being proactive.
Okay.
If you're concerned, talk to your doctor.
Right.
Early intervention can make a big difference.
So don't wait.
Right.
Talk to your doctor early.
Exactly.
Okay.
Anything else?
Yes. Remember, you're not alone in this.
Mm-hmm.
There are resources available to help you.
Your doctor, therapists, support groups.
Exactly.
Okay, that's good to remember. So what are we diving into in the next part?
We've talked a lot about the different treatments, but let's shift gears now
Okay.
and focus on you, the listener. What stands out to you from all this information? What questions do you have for your doctor? That's a great question. Join us for the final part of our deep dive to explore those questions further. All right, welcome back to our deep dive on Peyronie's disease treatments. We've covered a lot of ground, right? Debunked some myths, looked at tons of treatments, even peeked into the future of research.
It's been a really comprehensive overview. Hopefully everyone listening is feeling more informed about this complex condition.
Absolutely. And speaking of navigating all this information, you left us with a great question at the end of the last part. What stands out to you? What questions would you be asking your doctor at this point?
Yeah, let's shift the focus now.
Right, to the listener.
What are your takeaways? What piqued your curiosity?
Exactly. So, listener, what are you thinking? What's resonating with you?
You know, one thing that really struck me is how individual treatment for Peyronie's needs to be. There's no magic cure, no one-size-fits-all solution.
Definitely. Every case is unique, right?
Exactly. What works for one man might not do a thing for another.
It's like a puzzle where every piece has to fit just right.
That's a great way to put it.
The severity of the curvature, the specific symptoms, overall health, erectile function, it all plays a role.
Absolutely. And let's not forget about the importance of timing. Early intervention is so crucial.
Right. The sooner you seek treatment, the better.
Exactly. The better the chances of slowing down the disease,
Right.
preventing complications.
So if you're noticing any symptoms, don't wait. Talk to your doctor,
Yes, absolutely.
get informed, be proactive.
The sooner the better.
Now, while we've covered the medical aspects in detail, we can't ignore the psychological impact of Peyronie's disease.
Right. It's not just about the physical symptoms.
Exactly. It can really affect a man's self-esteem, his relationships, his whole sense of self.
It's a very personal and sensitive condition.
It is. Imagine the anxiety and worry that can come with those changes to your body,
Absolutely.
especially when it involves something so intimate.
Right. It's understandable to feel stressed, down, maybe even insecure about it.
It can feel like your body is betraying you.
It can.
Yeah, that's a tough thing to process.
And unfortunately, there's still a lot of shame and stigma around sexual health issues.
Right, it can be hard to talk about.
It can. And that can prevent men from getting the help they need.
So they end up suffering in silence.
Unfortunately, that happens all too often. But I want to say to anyone listening who's going through this, you are not alone. There are so many men who have faced similar challenges and come out stronger.
That's really important to remember.
And there are resources available to help you cope.
Right. You don't have to go through this by yourself.
Definitely not.
Mm. So where can men turn for support? What are some of those resources?
Well, therapy or counseling can be incredibly helpful.
Okay.
Talking to a mental health professional can give you that safe, non-judgmental space
Yeah.
to process your emotions, develop some coping strategies, even work on communication with your partner.
It can make a huge difference.
It really can.
Just having someone to talk to?
Yeah, someone who understands.
Right. What about support groups? Are those helpful?
Definitely. Connecting with other men going through similar experiences
Mm-hmm.
can create a real sense of community.
Right. You're not alone.
Exactly.
It's a powerful thing.
It is. And it's not just about therapy and support groups.
What else can help?
It's crucial to take care of your overall well-being.
Okay, so self-care.
Yes. Make time for the things you enjoy, practice relaxation techniques, maintain a healthy lifestyle.
It's all connected, right?
It is. Taking care of yourself mentally and physically.
Right. So, as we wrap up this deep dive, what's your final message? What do you want our listeners to remember?
Knowledge is power. Learn as much as you can. Talk to your doctor. Explore your options. And remember, you're not alone.
That's a great message. Thank you so much for joining us on this deep dive into Peyronie's disease treatments.
It's been my pleasure.
We hope you found this information helpful, listener. Remember, reach out for help if you need it. You don't have to go through this alone. We'll be back soon with another deep dive into a fascinating topic, so stay tuned. Until then, stay curious, stay informed, and take care.